People have this ill-conceived notion that you can just switch whatever you want every single year, right? We've got an annual enrollment period that happens in the fall, October 15th to December 7th. The commercials come on TV and people think, well, now's the time I can switch my plan, not understanding that there are two different types of Medicare plans, supplementals and Advantage. One is a comprehensive, pay up front, you're covered in full, whereas the other is a pay-as-you-go style plan. And to switch between the two of those, depending on the direction you're going, there will be health questions that might prevent you from changing. A lot of people think, oh, well, Obamacare, the marketplace says there's no pre-existing conditions. You can't ask me about pre-existing conditions, so I can join or switch whenever I want. That's not Medicare. Medicare supplement plans, which are those fully comprehensive plans, they can take into account pre-existing conditions and they can ask you health questions to prevent you from joining in if you don't do so when you're new to Medicare.
Exactly. And I think something we got to point out is the whole reason we got rid of pre-existing conditions, for Obamacare and the Affordable Care Act was the pre-existing condition threshold was incredibly high. In some cases, it was like, do you have tinnitus? Which does not affect you in any capacity. The health questions in these tend to be more, have you had a heart attack in the past 2 years? Have you had cancer in the past 2 years? Have you had heart failure? Or do you have severe diabetes? So it's not like you have slightly high cholesterol or something like that. Like a lot of people can pass, but what a lot of people don't realize is they might say, oh, I'll take this Medicare Advantage plan while I'm young and healthy, and then I'll switch later. We always joke, you're not going to pull a fast one on the insurance companies. They planned out every single step of this to make sure they are maximizing, and they want you to pay into it the whole time. And in order for them to, keep their profit margins healthy and to stay in business and everything like that, they're going to make sure they're not taking on someone who's going to rack up 6 figures worth of medical bills in a year. If you're going to do that, they're going to make sure that you have to do it the entire time. But you can actually, regardless of your health, when you first turn 65, get into any Medicare plan, which is a nice thing.
Correct. That's the confusion for people is that when you're brand new to Medicare, like you mentioned, you can take any plan with no health questions that you have the option to take. But when you are not new to Medicare, that's when transitioning from one plan to the other can involve health questions. Now, this only exists in transferring between Medicare supplements or to go from an Advantage back to a Medicare supplement. There is no health questionnaire to go from a supplement over to the Advantage. To go from the comprehensive plan to the pay-as-you-go plan, well, there's no health questions because you're paying for everything you do along the way, so they don't really care how unhealthy you are. You're going to pay for everything you do. It's the supplement where they're paying for everything no matter what. That's when they need to take your health into consideration. But I'd say in 90% of states, this is the case, right? 90% of states, if you're not new to Medicare, you're going to have to answer health questions to go into a supplement or to change the supplement. But in some states, places like I think it's New York or Connecticut or maybe California, there are some states in which there are no health questions for Medicare supplements ever. You can always join into a Medicare supplement despite your health, but the cost is astronomically higher. For example, a Medicare supplement here in New Jersey that you can join no health questions up front and answer health questions down the road if you need to join later, it might be $150 a month. In New York, the same plan, which there's no health questions, might be $450 a month. That's a huge differential. That says, sure, you can join whenever you want, but you're going to pay 3 times the price to do it. And that's how they, again, protect themselves. You're not going to pull a fast one on the insurance company. If they're going to let you in without health questions, well, they're going to charge you a lot more to do it.
Yeah, exactly. They're like, oh, cool, you've been chilling with this Medicare Advantage plan for 10 years and now you got a heart surgery coming up. All right, give us all the money, man.
We'll take it, but you can pay us extra to do that.
Exactly. So it's almost like a double-edged sword where you say, oh, I can always get a plan regardless. It's like, yeah, but is it affordable for you? Which is a tough thing for people to get into.
Correct.
So
the more affordable the plan, the harder the health questions if you didn't join it right away.
Exactly.
That's an easy thing to think about. All right, so that, we'll summarize again. We've got Medicare costs, long-term care costs, drug costs, health questions with Medicare supplements. Now let's move